When you're pregnant, having access to good prenatal care can make a big difference both before and after giving birth.
I just remember back in 2019, pitching the idea of an app to support moms in that postpartum period. And now we have that app. We have the mobile OB unit. We have a virtual fetal monitoring that's centralized, watching those moms while they're in labor. We just continue to grow and expand and think about how we can support moms through their entire pregnancy journey. And it has been so excited to see the growth.
That's Kate Johnson, Manager of Women's Services Digital Care for OSF OnCall. And I'm Shelley Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. More than 2 million women of childbearing age live in what are called maternity care deserts in the United States. Those are areas with no hospitals, birth centers, or obstetric providers, with millions more in areas with limited access. These deserts, often in rural areas, are growing due to hospital closures and provider shortages, leading to increased risks for pregnancy complications and maternal mortality. OSF HealthCare through OSF OnCall is looking at new ways to change that. Joining me today to talk about a new initiative is Kate Johnson, Manager of Women's Services Digital Care for OSF OnCall. Let's talk about this most recent addition to everything offered through OnCall. It's a mobile van. Tell me about that. I mean, it sounds super cool, is it?
Yeah, it is very cool. It is actually an extension of our pregnancy and postpartum support program, which is our virtual app that moms can get access to starting at 8 weeks of pregnancy through 6 weeks postpartum. And we were blessed to get a grant to actually fund this van, and it's basically an OBGYN office on wheels. It has everything we need: an exam room, an area to collect labs, an area to get vital signs, and it even has a bathroom. So it's pretty state of the art.
I was just going to say, tell me about all the services, but you're doing blood work. I heard you're even doing sonograms?
Yes, we have a point of care ultrasound. It's a small little ultrasound probe that we use to do some limited scans so we can check to see when baby's due, what position baby's in, that fluid level to make sure everything's going okay. So it's very exciting.
So what areas, obviously you can't hit the entire state of Illinois, it'd be nice, but we're not there yet, but what areas are benefiting from this service?
Yeah, we have about 10 counties that we're covering currently, several counties around Galesburg, up in the I-80 region, and then right here around Peoria. So we're partnering with our own hospitals for delivery and really capturing those rural counties that surround those hospitals.
What are the stories you're hearing from the women who you serve? Because sometimes they have no other access to care, do they?
That is absolutely true. Our first patient was actually in a really great story. She had not received any prenatal care. She was 32 weeks pregnant. She had 3 children at home, no car, and she lived right here in Peoria. So she was very close to services, but could not get there because she had no transportation. So we were able to bring the van right to her home. She didn't have to worry about her kids. We saw her for several prenatal visits, and then she went into St. Francis and had a repeat C-section and delivered a beautiful baby girl healthy. So it doesn't necessarily have to be somebody in the rural communities. It could be somebody right here in our cities that just doesn't have access to transportation to actually get to those visits.
Do you think people would be surprised at how many stories there are like that out there?
Yes, I think there are many women that just cannot get to traditional care for many reasons. We actually had another patient who actually had a poor experience at another hospital, kind of lost trust in the healthcare system. She was struggling with a lot of things, a lot of social drivers, and was so happy to come on the van. She said, "You're the first people to actually listen to me, to understand my story. I feel comfortable with you." So that was really heartwarming for us to hear.
I imagine you set up that relationship because there's a dedicated team that manages the van, correct?
That is correct. I have a team of 5 OB-trained advanced practice providers and our wonderful unicorn of a van driver / certified medical assistant. She's fantastic. So they take turns going out to see patients in the various regions. And then on the back end of that, we have that whole virtual program, that pregnancy and postpartum support program that's manned by my nurse team 24/7, 365. So these moms are getting that in-person care on the van, but that virtual assist on the back end.
Because sometimes it's just having somebody to talk to, isn't it?
Yes, absolutely. We have moms reach out all the time that just say, I feel like my depression's getting worse, I feel more anxious, or I'm worried about this with my baby, or can you help me get access to the supplies I need? And those nurses are there and ready to help and assist immediately.
Yeah, I think sometimes people don't know what they don't know. And so knowing, because there's tons of resources out there.
Yes.
But if you don't know how to ask, it's hard, isn't it?
That is correct. We're so blessed to be able to work aside our digital health navigator team, who they're located in 8 hubs across our state. So they're very plugged in to those regions. They understand what's necessary community-based organizations are out there. So we can really put in that assessment, have them really talk to that patient, understand what their needs are, and plug them into something that's near their home, which is so nice.
So moms out there listening to this, or their providers, or family members, or somebody who hears this, how do people get connected to this program?
So this program is open to any woman in the state or those counties that we're serving that have Medicaid insurance. So you can have primary or secondary Medicaid to qualify for this van service. The easiest way would be to go to our website, which is osfoncall.org/pregnancy. There is a self-enrollment form on there for our pregnancy and postpartum support program. So that's really step one. We want to get you that virtual support that's pushing that education and check-in to you. And then if you're having trouble getting to your prenatal visits, please let that team know and we can plug you into a van visit. It is a scheduled visit. We come directly to the patient's home or wherever they feel comfortable having that visit. We can meet at a community-based organization if that's more comfortable, but we want to make sure that we're getting those appointments scheduled for you. And then we offset that with virtual visits with that same APP team. So there's some of those visits we don't need to see you in person. We can just call you virtually using MyChart and do a video visit. So it's super easy. The other way is you could call us directly. Our phone number is 844-381-3603, and you can press option 2 to talk to our enrollment team.
And obviously we want moms to start as soon as possible once they know they're pregnant.
Absolutely.
Don't wait till our friend, like we were talking about, 32 weeks along. We would love to see you like typical pregnancy. You should be seeing a healthcare provider throughout, correct?
That's absolutely correct. We'd like to see you starting around that 7 to 8 week mark, and then see you for sure in person before you're 12 weeks.
What are you hearing from our mission partners, our employees who are involved in this program, or even just kind of around the periphery of it? What's the feedback?
Yeah. Our APPs are so excited about this model of care. They obviously have a heart for OB, the population, and they've all kind of came from that previous inpatient experience where you only have that patient for 24 to 48 hours. You hear all the things they have going on, but you don't have time and you don't have the ability to help them with those things. Now they actually get to dig in, help those patients, take the time, and ensure that they're getting the care that they need.
Yeah, I bet there's some real attachments that
definitely
come out of this one. Yeah,
For
that
sure.
they probably, even when they've been technically discharged,
Yes.
they probably still stay in touch with them, don't they?
Absolutely. Absolutely.
What do you take away from it personally? I mean, you've been around some of this stuff and in the development of a number of these programs through OnCall. What does it mean for you?
It is an absolute dream come true. I just remember back in 2019, pitching the idea of an app to support moms in that postpartum period. And now we have that app. We have the mobile OB unit. We have a virtual fetal monitoring that's centralized, watching those moms while they're in labor. We just continue to grow and expand and think about how we can support moms through their entire pregnancy journey. And it has been so excited to see the growth. And I just hope that we can continue to spread that around the OSF ministry and really help all those moms out there.
Is there a potential for more vans in the future?
I hope so. My dream is 10 vans across the whole entire state of Illinois. I hope that we get to that point. I know that our state could use it, especially in the southern regions. There are quite a few maternity care deserts in those regions. So I'm just excited for the future.
Well, Kate Johnson, I appreciate your enthusiasm and you taking time to stop by and tell us about all the excitement, because it truly is an exciting thing for both the people running the program and the moms. I mean, it's just so nice when you give them another option.
Absolutely.
Thank you. And thank you for joining us as well for this edition of OSF HealthCare Accelerated. Remember, you can catch any episode at osfhealthcare.org/accelerated.